This you're seeing is lumbar plexus, and this one is L1 vertebra, L2, L3, L4, L5. And you know these lumbar spinal nerves, they emerge from below to the numerically corresponding vertebrae. So these are the anterior primary rami of the spinal nerves, L1, L2, L3, L4. So the green color one you're seeing is femoral nerve. It's arising from the dorsal division of the anterior primary rami of L2, L3, L4. In this image, you're seeing is femoral nerve, and it's descending down here between the two muscles, iliacus laterally and medially. It's the psoas major to descend down into the thigh by passing below the inguinal ligament. This is psoas major, and this one is iliacus. This is a schematic way of representing the branches arising from the femoral nerve. As you can see that this line, the green, the dotted line they have shown, this line is the inguinal ligament. So the two branches from femoral nerve arising before it crosses the inguinal ligament. One is branched to the iliacus and other is branched to the pectineus. However, this nerve to pectineus, it innervates pectineus after reaching into the thigh. Then around 2.5 centimeters below to this point from where it enters into the thigh, this point here is called midpoint of inguinal ligament. So 2.5 centimeter below to this, femoral nerve divides into its two division, anterior and a posterior division, as you can see in the image. They are split across to this artery, the lateral circumflex femoral artery. Anterior division descends anterior to this artery and posterior division crosses behind to this artery. So the anterior division, you can see, gives out these cutaneous branches. One is the intermediate cutaneous nerve of thigh and the other one is medial cutaneous nerve of thigh. And generally, it's the intermediate cutaneous nerve of thigh which gives a branch that supplies sartorius, or sometimes this branch to sartorius may be arising from the anterior division itself. Mostly it's been seen that it's a branch arising from the intermediate cutaneous nerve of the thigh. Then the posterior division supplies to the muscles of the front of thigh. These are rectus femoris, vastus lateralis, vastus intermedius, vastus medialis. The important points here is that the branch to the rectus femoris also supplies the hip joint, while branches to these vasti, the three vasti, all of them, they descend down to supply the knee joint. But the proprioceptive sensations from the knee joint are carried by the nerve to vastus medialis. One important thing is you can see that the posterior division continues as saphenous nerve, which is arising from the posterior division of the femoral nerve. It perforates the deep fascia on the medial side of the knee joint, and then it becomes cutaneous. And when it becomes cutaneous, it soon gives its branch called infrapatellar branch, which supplies the skin overlying the ligamentum patelli. Then it supplies skin on the medial side of the leg, and it supplies the skin on the medial side of the foot up till the ball of the greater toe. So remember all these important points, and remember that saphenous nerve is a branch arising from the posterior division of femoral nerve.